going to start the arterial supply, the venous supply and also the nervous supply of the heart. So first we'll start with the arterial supply of the heart. So if you see, mainly the two coronary arteries are playing a major role in the case of formation of arteries of the heart. What are those? The major first one is the right coronary artery and the next major one is the left coronary artery. So you can see here, this is the left coronary artery, this is the right coronary artery. So these are the major one which are going to form our arteries of the heart. So these two coronary arteries mainly supply the heart and which rise from the ascending aorta. So you can see here, this is the ascending aorta, right? So ascending aorta is the origin for the two, in the case of two arteries, either the right coronary artery or the left coronary artery, two are going to arise from the ascending aorta. So it's their origin. So ascending aorta lead to formation of both arteries and they run in the coronary sulcus. So if you see here, this is a coronary sulcus. So what is coronary sulcus actually? Coronary sulcus is nothing but atrioventricular sulcus, means it is lying just in between the atria and the ventricle. So this is the coronary sulcus. So you can see right coronary artery is also moving in the coronary sulcus. At the same time, even the left coronary artery is moving in the coronary sulcus, because here this is the left auricle and this is the left ventricle, right? So even it is atrioventricular groove or the atrioventricular sulcus, that is nothing but the coronary sulcus. So this is a left coronary artery. So both run in the coronary sulcus. And next what you have, so we'll see now mainly about the right coronary artery in detail. So right coronary artery, it's smaller when compared with the left coronary artery and they mainly arise from the aortic sinus. So what is aortic sinus? Inside this ascending aorta you have root, right? In that for example I show it here. So here you can see this is ascending aorta, right? So in this we'll have cusp. Inside the cusp, the space which is present is called as sinus. Hence we'll say the right coronary artery is arising from the sinus, aortic sinus. So from there it origin and it travels between the root of pulmonary trunk and the right auricle. So you can see this is traveling in between the pulmonary trunk and right auricle. So this is right auricle, this is pulmonary trunk. So in between them first it starts its journey. So as it started its journey from here, so now it moves in an anterior coronary sulcus. So you can see this is an anterior coronary sulcus. So after moving there, it goes into the junction of right and inferior border of heart. You can see this is a right border of the heart. This is the inferior border of the heart. So it reaches here, and next it may either go into backside or posterior side, or either may continue as a marginal branch of the right coronary artery. So these are the thing now where it has started it traveling between pulmonary trunk, right auricle. It will move in the anterior coronary sulcus and ends in the junction between the right border and the inferior border of the heart. So next it will wind around the inferior border and reach the diaphragmatic surface. So this is the diaphragmatic surface where you will get your right coronary artery back. So for example, it has come now backward. So you can see here it is coming on the posterior surface, also called as diaphragmatic surface, and it is running backward to mainly the left side in the right posterior coronary sulcus. This is actually a right posterior coronary sulcus, that is nothing but right atrioventricular groove. So here it comes and mainly reaches the posterior interventricular groove. So this one you can see middle cardiac vein. This is also a branch of right coronary artery but on the posterior side. So finally it terminates by anastomosing with the circumflex branch of left coronary artery. So circumference branch, you can see here, this is a circumference branch of left coronary artery. So the right coronary artery comes in the posterior side, it ends, finally it is ending point. So the ending point is anastomosis with the circumflex branch of left coronary artery. So it has started in the, you can see it has started in the ascending aorta, starting from the ascending aorta, moving in the anterior coronary sinus, going backward, and in the backward it is coming towards first atrioventricular groove, that is posterior atrioventricular groove, that is nothing but posterior coronary sulcus, and later this posterior one is called it is coming to posterior interventricular groove, not to the coronary sulcus. Posterior interventricular means in between two ventricula here, coming into the posterior interventricular sulcus and later anastomosing, finally ending in the circumflex branch of left coronary artery. So this is a about right coronary artery. Now we will see what are the branches of right coronary artery. So you can see here the branches, they are divided into large branch and small branch. The largest branch is the marginal artery. So you can see this is the marginal branch which is very large. It is going up to, you can see, like nearly to the apex. So this, and also we have posterior interventricular artery. So we'll see here posterior descending branch of right coronary artery. So this is a posterior interventricular artery. These both are largest branches of right coronary artery. Next you also have some small branches which is only seen in 60% cases, like right atrial, infundibular and terminal. So small branches are right atrial, somewhat here towards the atria they'll give, right? So right atrial, and another one is infundibular. Infundibular also will be like here, and next you have the terminal arteries. So next we'll check out the area of distribution, means this right coronary artery supplying what parts. So if you see here, this is the right atrium, right? So it will supply the right atrium. It will also supply the ventricles, and mainly it will supply the great part of the ventricle except the anterior interventricular groove. Yeah, anterior interventricular groove it will not supply, but it will supply the posterior interventricular groove, and also it will supply the small part of left ventricle which is adjoining the posterior interventricular groove. You can see this is a posterior interventricular groove. So of course this will be the this will be the left ventricle, this will be the right ventricle. So as it is coming this way, even some part it may also supply to the left ventricle. So this is the area of distribution of right coronary artery, and it will also supply the posterior part of interventricular septum whole conducting system except the left branch of atrioventricular bundle, AV bundle. SA node is mainly supplied by left coronary artery, about 40%. So you know, here is the left coronary artery supplies mainly the SA node, but some part of AV node is supplied by the that left branch of AV node or AV bundle is supplied by the right coronary artery. Now we'll see some details of left coronary artery. So left coronary artery, as we are discussing, is larger than the right coronary artery. It is arising from the left posterior aortic sinus. So left posterior aortic sinus give origin to the left coronary artery, and this left coronary artery is larger, and it first runs between the pulmonary trunk and left auricle, the same. So here the pulmonary trunk, here the left auricle. So in this diagram it's very clear. This is the pulmonary trunk, this is the left auricle, so in between it will pass. So this is our left coronary artery, and after passing like that, next where it will go. So it will run in between pulmonary trunk and left auricle and gives a anterior interventricular branch. So you can see this is an anterior interventricular branch, anterior descending branch of left coronary artery. So it gives an anterior interventricular branch which run downwards in the groove of the same number and further continue, called as circumflex artery. So it will form a circumflex artery, circumference branch of left coronary artery. So it is further forming a circumflex artery, and also give off anterior interventricular branch artery runs to left in left anterior coronary sulcus. So it also gives the anterior interventricular branch, already discussed, and winds around the left border of heart and continue in left posterior coronary sulcus. So you can see on the left side it forms a left circumflex branch of left side, left coronary artery. It forms a great cardiac vein, its vein we'll see later. So it is forming in a left, on the posterior side it's forming a circumflex branch of left coronary artery, and it winds round the left border of heart, continue left on left posterior coronary sulcus near the posterior interventricular groove, terminates by anastomosing with right coronary artery. So here this point, here it anastomos this left coronary artery, anastomos with the right coronary artery at the posterior interventricular groove. Now we'll see what are the branches. So the large branch of the left coronary artery is anterior interventricular branch. You can see this is the largest branch, and also diaphragm of left ventricular, to the diaphragm also it gives a branch, and it includes large diagonal branch. You can see this is a diagonal branch, this is also larger, and small branch are left atrial branch and also the pulmonary and terminal branches. These are the small branches. So where it supplies, mainly where the left coronary artery supplies, it supplies of course the left atrium, and also ventricles. Greater part of the left ventricle is supplied by our you can see greater part of left ventricle is supplied by our left coronary artery, except the posterior interventricular groove. It will not supply the interventricular groove because posterior interventricular groove is supplied by the right coronary artery, and even the small part of right ventricle adjoining it may be supplied by left coronary artery, and also anterior interventricular groove is supplied by the left coronary artery. So if you see, the anterior interventricular groove is supplied by the left coronary artery, whereas the right coronary artery supplies the posterior interventricular groove. And the anterior part of interventricular septum, part of left branch of AV bundle. So even the left coronary artery will also supply left branch of AV bundle, and also it will supply some anterior part. You can see this is the anterior part of interventricular septum, some anterior part. So these are all about left coronary artery. Next we will see what is cardiac dominance. So cardiac dominance is seen in 10% of heart, where the right coronary artery is very small and not able to give the posterior interventricular branch. So in this case, the circumflex artery, the continuation of left coronary, provides the posterior interventricular branch as well as to AV node. Such cases are called left dominant. So for example, if you see, sometimes the right coronary artery is very weak, so in that cases the left coronary artery is more active now, so the heart is called left dominant. So if the right coronary artery is weak, then the heart is called left dominant. Mostly the right coronary artery gives the posterior interventricular artery, we know this one. So such heart is called right dominant. So if right coronary artery is more active, then right dominant. Therefore the artery giving the posterior interventricular branch is dominant artery. So the right coronary artery is called the dominant artery. Now we will see what is collateral circulation. So the cardiac anastomosis, that is the two coronary arteries anastomose each other in myocardium. So you know, cardiac anastomosis, collateral circulation, where we have seen in the case of right coronary artery, it will anastomose with left coronary artery, whereas left coronary artery will anastomose with right coronary artery. So those are cardiac anastomosis. Next we will see what is extracardiac anastomosis. Sometimes the vasa vasorum of aorta and pulmonary arteries, internal thoracic artery, bronchial arteries, phrenic arteries, and last three mainly anastomose. What is the last three? That is internal thoracic artery, bronchial arteries, phrenic arteries. They anastomose through pericardium, and these channels may open up in emergencies when both coronary arteries are obstruction. So actually what is extracardiac anastomosis? So collateral means sometimes the main arteries like right coronary artery, left coronary arteries, if they are damaged because of any heart problem, then this collateral arteries like internal thoracic, bronchial arteries, phrenic arteries, they anastomose with the pericardium, and they give the blood whenever it's necessary, especially in coronary arteries are obstruction. So retrograde flow of blood in veins may irrigate the myocardium. So sometimes the retrograde backward flow in the veins may also sometimes give the blood to the myocardium and help in the cases like coronary obstructions. Now we will check out the venous supply of the heart. So if you come to the venous supply of the heart, we have mainly the great cardiac vein. So where is that? This is the great cardiac vein, and you have the middle cardiac vein. So you can see this is the middle cardiac vein, and also you have the right marginal vein, and you have the posterior vein of left ventricle. Actually you will have an oblique vein over here, it will be coming like this. So here you will have the oblique vein also, and next you will have the right marginal vein. On right side you will have the, here in the margins you will have the right marginal vein, and you will have the anterior cardiac veins and vena caudes minimi. So anterior cardiac vein, you can see here, this is the anterior cardiac vein, and also you will have a vein called as vena caudes minimi. So in this diagram you will get all the veins. This is the oblique vein of left atrium, you can see this is the oblique vein, and what I said before, the right marginal vein, it will be here, you can see the right marginal branch. So once you can check out here the veins of the heart, you have mainly the great cardiac vein, middle cardiac vein, right marginal vein, posterior vein of left ventricle, oblique vein, right marginal vein. All this mainly drain into the coronary sinus, but the last two like anterior cardiac vein, vena caudes minimi, open directly into the right atrium. These are the 2 points which you need to remember: anterior cardiac vein, vena caudes minimi, open directly into the right atrium. All other veins are opening into the coronary sinus. So we'll see what is coronary sinus. Coronary sinus is the largest vein of the heart. It is situated in the left posterior coronary sulcus. So you know what is the posterior coronary sulcus. For example, if you see this is a posterior side of the heart, so here you will have the posterior coronary sulcus. So the largest vein of the heart situated in left posterior coronary sulcus ends by opening into the posterior wall of right atrium. So mainly they open into the posterior wall of right atrium. So for example, if you see over here, this is a right atrium on the posterior side. So mainly here you will find out that coronary sinus. So mainly the great cardiac vein accompany the anterior interventricular artery and then left coronary artery enter the left end of coronary sinus. So I'll show you. So you can see this is a great cardiac vein. So the great cardiac vein mainly accompany also anterior interventricular artery, because this interventricular groove, right? So anterior interventricular artery and also then left coronary artery enter the left end of coronary sinus. So like this, they go like this and they end in the, this is right atrium, right, on the posterior side. I will draw the dotted line so that you can understand. All the dotted lines are on the posterior side. So this goes and drains into the this posterior coronary sulcus of the right atrium. So next you have our middle cardiac vein. So you can see this is a middle cardiac vein. The middle cardiac vein accompany the posterior interventricular artery. If you can see the word posterior interventricular artery means this middle vein is going towards the back side. You can see the middle vein is turning here and going on the posterior side. It will go on the posterior side, accompany the posterior interventricular artery and joins the middle part of the coronary sinus. So the final destination is coronary sinus for all veins, but they go for example, if you see in great cardiac vein, it is going on the anterior side only, whereas the middle cardiac vein is going on the posterior side and going to the right atrium, especially this coronary sinus. And next you have the small cardiac vein. So if you see, this is a small cardiac vein. The small cardiac vein accompany the right coronary artery in the right posterior coronary sulcus. Means the small cardiac vein is also going on the posterior side and join the right end of coronary sinus. That is the right marginal vein may drain into small cardiac vein. So join the right end of coronary sinus. Right marginal vein may also drain into the small cardiac vein, and finally they open into the coronary sulcus. So only one logic is all these veins need to go to the posterior side. Why? Because the coronary sulcus of the right atrium is situated on the posterior side. As it is situated on the posterior side, all these veins need to drain into it. So first, of course, they start from the anterior side, next they loop into the posterior side and end into this coronary sinus. And next we have a oblique vein. Before oblique vein, of course, we have posterior vein of left ventricle run on the diaphragmatic surface of the left ventricle and end in the middle of coronary sinus. You have posterior vein and also you have oblique vein. So actually oblique vein comes like this, it's obliquely passing, and it's also called as oblique vein of left atrium of Marshall. So I will show that vein here. So you can see here the oblique vein of Marshall. So this one here, over here. So the oblique vein of Marshall is also a small vein running on the posterior surface of the left atrium and mainly terminates it in the left end of coronary sinus. Develops from the left common cardinal vein or duct of Cuvier, which sometimes form a large left superior vena cava. And also you have a right marginal vein which accompany the marginal branch of right coronary artery and may either drain into the smaller cardiac vein or directly open into the right atrium. So remember that few veins like anterior cardiac veins, vena cordis minima, open directly into the right atrium, but these all like great cardiac vein, middle cardiac vein, small cardiac vein and small cardiac vein, they are opening indirectly by going on the posterior side and opening into the coronary sinus. You can see here, for example, anterior cardiac vein, it is opening directly into the right atrium. So the main point is here, the meeting point is coronary sulcus, which is present in the right atrium posterior side. And you also have the right marginal vein, which is accompanying the marginal branch of right coronary artery. This may either drain into small cardiac vein or directly open, already discussed. Now we'll see something about about anterior cardiac veins. So 3/4 of them are small veins and run parallel to one another on anterior wall of right ventricle, and they usually open directly into right atrium by its anterior wall. Next, venae caudae minimi. They are also called as Sebastian veins or smallest cardiac veins. So these are the smallest cardiac veins, hence the name minima. You can see minimi means small veins. So they are numerous, present in all four chambers, open directly into the cavity, and numerous on right side of the heart. Of course, if they are numerous on right side, very easy for them to go on to the posterior side of the coronary sinus than the left. So the left side infarcts are more. So remember, as these veins are more on the right side, so that is the reason why the left side's infarcts are more, because as these veins are on right side, so there's more blood supply here, right? Now we'll see about lymphatics. So of course, lymphatics also accompany the coronary arteries, and they form the two trunks. The right trunk end in the brachiocephalic nodes, and the left trunk end in the tracheobronchial lymph nodes, especially at the bifurcation of trachea. So where you find the lymphatics? At the bifurcation of trachea, the end. This is important. The right trunk end in brachiocephalic nodes, left trunk end in tracheobronchial lymph nodes. So tracheobronchial lymph nodes for left trunk, right trunk for the brachiocephalic nodes. Now we'll see the last part, that is the nerve supply. So for the nerve supply, we'll understand this diagram. So mainly the nerve supply for the heart is by parasympathetic nervous system and also the sympathetic nervous system. So here in the diagram, if you see, this is a vagus, right vagus, left vagus. Vagus means what? It's a parasympathetic nervous system. Sympathetic chain, you can see the word here. So this is a sympathetic nervous system. So mainly the autonomic nervous system is supplying to our cardiac. You can see deep cardiac plexus. We have the two types of plexus which are formed by the heart. One is the superficial cardiac plexus, another is the deep cardiac plexus. We'll understand one by one. So we'll start the nerve supply. So mainly the parasympathetic nervous system reach the heart via vagus. That is mainly they are inhibitory, cardio inhibitory. In stimulating them, they will decrease the heart rate. Means they lead to bradycardia. Whereas in the case of sympathetic system, they are derived from upper 4 to 5 thoracic segments. If you see here T1 to T5, right? These are the T1 to T5 ganglions. So the upper 4 to 5 thoracic segments of spinal cord are cardio-acceleratory, means they increase the heart rate, and also they dilate the coronary arteries, whereas parasympathetic, they constrict the arteries. So both the parasympathetic and the sympathetic, they form the superficial and deep plexus, the branch of which run along the coronary arteries to reach the myocardium. So finally this plexus reach where? Myocardium. The myocardium is the primary site for them. So where they bring the changes. So superficial cardiac plexus is between the arch of aorta in front of right pulmonary artery. This is important. Where the superficial plexus is located? Below the arch of aorta in front of right pulmonary artery, and it is mainly formed by only two branches. Very important to remember and very easy also. So first, if you learn about the deep cardiac plexus, it's very easy to learn about superficial cardiac plexus. How? Let us check out. So deep cardiac plexus, remember that all the sympathetics from the right side will come to the deep cardiac plexus, and also all the vagus, all the parasympathetic from the right side will come to the deep cardiac plexus. But the left side only have some problem. The left side, especially of parasympathetic, the superior branch will not come. It's an exception. But the inferior one, everyone will come and drain into they give the information to the deep cardiac plexus. And here also the superior cervical ganglion is an exception. Remaining all will come. So remember, all the right side are coming to the deep cardiac plexus, and on the left side, except the upper one, all the lower one are going to the deep cardiac plexus. So where this two will go, of course they'll go into the superficial cardiac plexus. So the superficial cardiac plexus is mainly made up of superior branch of vagus or parasympathetic nervous system, and by superior cervical ganglion of sympathetic nervous system. So these two are mainly forming our superficial cardiac plexus. So once again, the superficial cervical cardiac branch of left sympathetic chain and the inferior cervical cardiac branch of left vagus gives the deep cardiac plexus. Right coronary artery, left anterior pulmonary plexus, all this of course they form the deep cardiac plexus, but only for superficial cardiac plexus you need to remember this both. Next, of course, where is the location of deep cardiac plexus? It is situated in front of bifurcation of trachea, behind the arch of aorta. So, in front of arch of aorta, you will have the superficial cardiac plexus. Is below the arch of aorta. This is behind the arch of aorta. You have the deep cardiac plexus. You can remember mainly the bifurcation of trachea. So, it is formed by, of course, all cardiac branches which are derived from cervical, upper thoracic ganglion of sympathetic chain, cardiac branch of vagus, recurrent laryngeal nerve, except superficial plexus. So everything is there except superficial plexus. Right and left, right and left valves distribute the branch to coronary and pulmonary plexus. Separate the branch given to aorta. Once we will see, actually, okay, we have said what is what, but we need to know the names which are supplying the deep cardiac plexus, right? So from the sympathetic right chain, you will get the superior cervical ganglion. Next you have the middle cervical ganglion. Next you have the inferior cervical ganglion and T1 to T5 ganglion. Whereas coming from vagus on right side, you have superior branch, inferior branch, recurrent laryngeal nerve. So coming to left side is exception, the superior branch to the superficial cardiac plexus. Inferior branch, of course, comes here. And next, coming to this sympathetic chain, you have your superior cervical ganglion will come here. There's middle cervical ganglion, inferior cervical ganglion, T1 to T5 all go to deep cardiac plexus. Oh, sorry for here regarding PNS. It's not a superior branch, it's an inferior branch. So if you see the diagram keenly, then you will understand it's an inferior branch. Inferior branch is exception and superior cervical ganglion is exception. So if you see here, the inferior branch is giving its direct arterial to the superficial cardiac plexus, and from here, from the sympathetic chain left side, you see superior cervical ganglion is giving its direct impulse to the superficial cardiac plexus. So here the inferior branch of vagus, PNS of left side, and here also of left side, superficial cervical ganglion of sympathetic nervous system. So this is about a nerve supply of a heart.